Welcome to the YMyHealth Podcast. It's your co-host, Melissa Schenkman here, and we're going to be talking about a topic that is so important to our generation, which is colorectal cancer awareness and screening options today because this is something we've talked about a lot with YMyHealth. We do a lot of advocacy work, and the numbers that are predicted, just for one example, by 2030 for people under the age of 50 is 27,400 people are predicted to be diagnosed. And so it's so important that we know what our screening options are that are out there. And as always, we love to stay cutting edge. And today is very cutting edge. We are super excited to have Dr. Erica Barnell here with us. She is the co-founder and chief medical officer of Genoscopy. And she earned her MD, PhD at Washington University School of Medicine and was focused in molecular genetics. And she has led the development of ColoSense, which we're going to talk about today. It is the first FDA-approved RNA-based stool test for colorectal cancer screening and approved for those who are 45 and up, which the oldest millennials are about to know that age very soon. And she's done a lot of work in the RNA technology space. And so we're really excited to have you. Welcome, Dr. Barnell.
Thank you so much for having me. Please call me Erica.
Okay, absolutely, Erica. Thank you. We'll do. Well, just wanted to start off with kind of when you knew you were going to pursue medicine. There's so many different areas of the body that you can specialize in. What initially drew you to the field of gastrointestinal health?
Yeah, I think, there's really two types of medical students. There's the Grey's Anatomy, Meredith Grey, who has known they wanted to be a surgeon since they were 4 years old, right? And then I think there's a lot of people out there that go to med school that are maybe more like me, like the Eliza Thornberrys, who just are kind of nerds and love science and spent a lot of time in their undergrad, learning organic chemistry in the basement of their favorite library. And so when I went to medical school, I kind of really didn't have a vision for what I wanted to be when I grew up, but I've been doing a lot of research in gastrointestinal health. I have been doing, a lot of clinical rotations as part of my medical training. And I actually met a woman who presented to the hospital with stage 4 colorectal cancer.
Oh,
She
wow.
was just over 50 and she had kids and she had a job and she was too busy uh, to get screened. And I thought to myself, in the era of precision medicine, where we can sequence a genome in 24 hours, where we can provide individuals with so much comprehensive care, why are we offering screening to offering colonoscopy as our only screening option? So at that point, I kind of founded Genoscopy with the hope to build diagnostic tests that could integrate with the lives of our patient more effectively and get patients screened where they are.
Um, Absolutely. That is really, I can see how that made such an impact and really kind of helped you in finding your path to where you can make such a difference, and you are making such a difference. You're welcome. You're welcome. And kind of as you progressed in your medical education, I'm really curious, with your years of research and training, what information was shared with you as a student, as a graduate student, about early onset colorectal cancer, and is there anything in particular that has stayed with you about that?
Yeah, I think, you know, when you get trained as a medical student or even as an undergrad, they're starting earlier and earlier with good reason. We're trained on what is healthy and what is disease. And we're being trained by physicians who have been in the business, their whole career. And they're teaching you a lot of what they're teaching you is, um, maybe a little outdated. Maybe it's reflective of, the culmination of their career, which could have started 50, 60 years ago. And
True.
so I think what was really great for me is that I had the opportunity to join Sling Health here in St. Louis. I had the opportunity to engage with a really robust ecosystem, startup healthcare ecosystem here in St. Louis, where I wasn't just learning from physicians. I was learning from entrepreneurs. I was learning from people in the healthcare industry. I was learning from people who engage with the FDA and engaging with payers. So I think being able to build the business not just from the lens of a trained physician, but with
Mhm.
kind of an integral entrepreneurial ecosystem. I think it made our business model and the ultimate development of genoscopy really successful.
That's wonderful. Absolutely wonderful. And as a physician scientist, kind of what are some of the challenges and opportunities in medical care and research that you see when it comes to colorectal cancer in people under the age of 50?
Absolutely. I think, healthcare is a multi-trillion-dollar industry and everything is broken. So just kind of point and fix um, is my mentality. But, I think especially our generation, you're talking about the millennials, we, we haven't thought about colorectal cancer, we
Right.
just, we don't. That's, I always say to myself, like, it's weird because this woman is you know, born in 2010 and, she's a young mom. And I'm like, but I was born in 1990 and I'm also a young mom,
Right. Yeah.
You kind of don't view yourself in the same way. I don't view myself as coming up to an age for colorectal cancer screening, is what I
Of
would say.
course.
So I think being able to start educating the community that colorectal cancer screening is for you. Colorectal
Yes.
cancer screening
Yes.
is for people who are under the age of 50. 45 is the new
Yes.
50. And I think
Yes.
soon 40 is going to be the new 45. Um, so trying to educate the community, trying to educate our generation that screening is important as we're starting to see a rise in incidence and diagnosis of late stage disease in patients that are not 60 and up, but are 50 and under.
Yeah. No, excellent points. Because it's true. It's very hard for us to see ourselves at that right?
Right.
At that point, right? And I think that's a big barrier to things too that people don't talk about enough. And in terms of kind of some of the biggest barriers, right, when it comes to testing. So you had mentioned one of them, but time, which you were talking about, time, the cost. I think when it comes to colonoscopy in particular, drinking the prep is a well-known one, yes, which is just delicious. And
Delicious.
yes, definitely. And honestly, I think knowledge about which test offers what and what tests are even available. And as a fellow millennial who is an expert in science and colorectal cancer screening, kind of walk us through what today's landscape looks like in terms of our colorectal cancer screening options. And because there are a lot, and I think a lot more than people realize, honestly, including
Correct.
wonderful ColoSense. So yeah.
Yeah, I think, traditionally we've offered colonoscopy, right? Not only does that require you have active primary care visits,
Yeah.
your physician's educating you on it, you get a referral, you go to the gastroenterologist, you consent onto the procedure, you
Yeah.
do the prep, you complete the colonoscopy.
Yeah.
So many barriers there, right? And a lot of people that are working, a lot of people that have young kids, a lot of people that are in school, a lot of people who, you name it, doing whatever it is that life brings, can't get that done. So I think we now have a number of non invasive options that have been FDA approved. I think that brings about what humans want, which is choice and
Yeah.
opportunity.
Yes.
We provide a stool based test that is delivered directly to your home. So you can
Wow.
go on our portal, you can get a telehealth visit. It comes directly to your home if you're qualified for one of our tests. You
Yeah.
can complete the test in the comfort of your own home. We've mitigated a ton of barriers in terms of producing a sample. So while most stool based tests require you to manipulate your stool and do a little science experiment there. Our test does not require that. You just poop and ship back. We've
Mhm.
also mitigated a lot of that ick factor. So
Right.
you don't have to go talk to the FedEx person, right? It has a prepaid label. You just drop it off in that box and
Love it.
it comes right back to our lab. So I think at every touch point, we've tried to make it really easy for patients and try to integrate into their busy schedules so that they can get screened with a test that they know is accurate and is going to provide them insight into their health without really interfering with their day to day life.
Which is, I think, what makes things so effective. And you also have to have, which you do and your team does, the knowledge of what those other barriers are to be able to design something in that way. And I think that for our generation that just works so well because of all those, yeah, because of all those barriers easily being able to be overcome. And let's talk about art because yes, which I'm guessing is a
What
favorite
is
topic of
RNA?
yours. Yes. So ColoSense is uses RNA technology. And so for our friends and listeners who are not in the science world, and maybe the last time they interacted with RNA was biology class many, many years ago, and that's okay. That's totally okay. I know that'll be the case for many in our audience. Tell us a little bit about what RNA is and what it can offer as a tool in research, um, and to develop a test. Like, generally speaking, how is RNA really useful in this way?
Absolutely. And I'll say my favorite topic is actually Star Wars, but I am more than happy. A is a very, very, very close second. And you're right. People kind of don't know the difference in terms of what it means for your health and what it means for your healthcare. But, it hasn't really changed since your seventh grade biology class, right? So
That's
RNA is the messenger of the cell. I think I learned that on, House of Rock or whatever it is. But it provides you with real time insight in what's happening in your cells, in your GI system. So, while there are a number of different DNA mutations or changes that can cause precancerous development or malignant
Mhm.
transformation, a lot of those changes converge on a universal signature that we detect in stool samples. So, whether you have an adenoma or a cancer that developed from a various pathway, all of that looks really similar to us. And that's how we can improve the accuracy of our tests and make sure that patients that are positive are going on to get a colonoscopy to have lesions removed.
No, that's really, really fascinating to hear and super, super, super helpful. I think people are gonna have a better understanding of why this is so important and so innovative in using it in this way. I was gonna ask you, I'm gonna pause for 1 second to close my door so I hear a little bit of extra noise. So hang on 1 second.
You're probably more sensitive to it than I am. I don't even hear noise. I have alarm fatigue from living in the hospital for so long.
Well, yeah, no, I can see that. That's totally see that. But yeah. Okay. Here. Now we won't hear anything. Outside, I was like, I just heard a little bit and I was like, "Oh no, don't do that since I don't have my headphones working." No, that's totally fine. Okay. So, and then also I realized in the beginning I mispronounced. So say again how you pronounce your yeah,
Genoscopy?
genoscopy. Okay, I'll go back and okay. I'm good. Okay. And my next question for you was about kind of how does genoscopy's ColoSense test differ from the other colorectal screening test options that we talked about earlier? I know you've talked a little bit about some of the barriers that it has eliminated, which are awesome. But when you think about some of the others, if you could talk a little bit about that.
Absolutely. So, as mentioned, we're very different than colonoscopy.
Yes,
I think a
definitely.
lot of that's clear. A lot of patients recognize that. But when it comes to kind of all the non invasive tests, I think it's not a one size fits all. Where I say our tests really shines is in the younger patient populations. So,
Sure.
since we're leveraging RNA based markers for diagnosis of disease rather than methylation based markers, which can be correlated with age, we've maintained accuracy in the younger patient populations where other tests have not, right?
Yeah.
So I think especially for patients that are younger, our tests may be more suitable just because of the biomarker that we're leveraging for diagnosis. The second big difference that we have, I kind of mentioned that it's kind of a touchless test, right? You get the
Yeah.
kit, you do what you normally do, you close it back up and you text us or text FedEx and they come pick it up from your door. I think when you look at some of the instructions for use for other tests,
Yeah.
it's confusing. You're like, I got to do what? I think, I felt that way with COVID, right? I have
Absolutely.
2 doctorates and I'm trying to get on a plane and I'm like, wait, what do I have to do? And you don't want to mess it up and you don't want to do anything wrong.
100%.
So our lab has taken on the entire burden of handling the sample and we've left the patient with just doing what they know how to do, which is
Yeah.
going to the bathroom every day. So I think that's one of the biggest differentiators from us, from other tests.
No, absolutely, and I think that that just makes such a difference because I know what you're talking about with the COVID test. Everybody still very much
Yeah.
talks about this, and you're like, "Oh my god," and different companies, some are even harder than
Yep.
even more complicated than others, but yeah, I think taking that out is really just more of our style, our generation style, I think, as well, and this could not come at a better time, as you know, because, like, even there are all of these I feel like I don't even know what the frequency is these days, but either, like, every 3 months, sometimes it feels like more than that, there's either a study that's come out, you're hearing news stories more than I think, over the course of the past 10 years, and you've heard before with regularity about the rise in cases. And the most recent one this month is there was like this new study published in the Journal of the American Medical Association, and it was based on data from the Dana-Farber Cancer Institute. And it was talking about a lot of different types of GI cancers. But when it came to colorectal cancer, it was again pointing out that there's this alarming rise, but it also, at the same time, was talking about the 45 to 49-year-old uh, group of people in our country and how that fewer than 1 in 5 get screened, even though they're eligible for screening, yet you have this rise in cases. And so, um, in your view, why is it important knowing all of this as we continue to see these things as members of Generation Y that as we approach our 45th birthday, which for most people, yes, for most people who have reached this point or about to reach this point, um, for the most part, is going to be happening in 2026 for a lot of them, and some, of course, second half, I think, of 2025. You know, why is it important for those of us once we reach this milestone to make colorectal cancer screening a priority?
Yeah, I think you can't open the news without seeing something, especially in healthcare. Colorectal cancer is the second leading cause of cancer-related deaths. It's the leading cause and going to be the leading cause of cancer deaths in men and women under 50.
Which is unbelievable.
Unbelievable. And the reason it's unbelievable, it's the most preventable but least prevented cancer out there, right? In the same way that if you didn't necessarily smoke, you have a less likely chance of developing cancer. In that kind of same way, if you get screened, you have almost a negligible
Yeah.
chance of getting a late stage cancer. It's not zero, but when I see things like Chadwick Boseman or James Vanderbeek getting colorectal cancer, and again, they're my peer, not my peers, but
Right.
I wish,
Close. Close.
but
Yeah.
my age and,
Yeah.
individuals that have probably great access to healthcare.
Absolutely.
So you start thinking about, you know, what's available to the general population, what's available to people our age, and how, again, can we integrate screening into our very, very, very busy lives. So I
Yeah.
think the message, again, is just trying to convey how easy it is to get screened
Yeah.
just to ensure that you're good.
Yeah.
Um, in the same way that you're able to brush your teeth every morning.
Exactly.
You drink your cup of coffee, you go use the restroom. It's that easy. And that's what I just kind of want to convey to people, is not putting it off and
Yes.
making sure you get screened, because we are seeing it and it's a part of our reality, unfortunately.
Yeah. No, no, absolutely. Excellent point. And I think too, it's hard because people it's something that isn't necessarily visible. People don't visibly look sick.
You're so
Most of the
right.
time before you're diagnosed, like, you have no idea, and so that's yeah, so I think pointing out and I agree as we each see these individuals who have had these, unbelievable careers, and I think the same thing as you, like, "Oh, they have amazing access to healthcare." This the cost isn't an issue, I'm sure they can take off time to go do it, and so I think looking at all of that and realizing and also it affects everybody.
It affects everybody. You're so right. And I think what's really great is, I think, relative to prior generations, I think we do care about our health. We
Oh,
are such
exactly.
health conscious. We're such a health conscious generation, and we very much care and very much spend a ton of time, resources, and energy taking care of our health, that this is just one easy thing. There's no patient out of
Yes.
pocket costs, covered under the Affordable Care Act. Whatever insurance you have, or even if you don't have insurance, we provide ways to help people pay for it. So I think,
Wonderful.
again, just the easier we can make it for patients to get it done, the better our outcomes are going
Absolutely.
to be.
Absolutely. Completely agree with you. And one of the other things that comes up, and I'm sure has come up in conversation with you before, yes, it comes up in conversation with us every time, of course, we go also to Fight CRC's Call on Congress event in March. This is a topic of discussion, is the age. And I have talked to many people about this, so I would love, and I know our listeners would love to get your view on this, and kind of where what you're doing, how that may change what that age is too, and your research is going to contribute to that very much as well, I think. So, while basically the screening age was lowered to 45, is lowered back in 2021. It's only a couple years ago. Uh, the which is a huge triumph in and of itself. Absolutely. But then we sit back and we say, okay, that's awesome. But when we look at the millennial generation, the first person that's going to reach that age, or the first group, is really later this year and then all in 2026. And that's 1 year's worth of people out of, say, 16 years worth more, right? Unfortunately. So progress, but as we all know, there's more to go. What kind of, in your view, what role do you see RNA-based tests and also ColoSense specifically, especially with the great data that you've gotten on it so far, and yeah, and 40 in the 45 to 49 age group, what role do you see in it possibly lowering that age? Because I know that that's something that a lot of people want, and also, and ultimately, more people who are younger getting screened. And I know there
Absolutely.
are a lot of factors that go into lowering the age. I wanna say before you start, like, I realize this is just one. Yeah.
Yeah, I think, because from our perspective, we're like, just do it, right?
Thank you.
Why,
Yes.
what,
Yes.
what is preventing you from doing
Yes.
what is the
Yes.
problem here?
Yeah.
And I think if you think about it from the perspective of the people making these decisions who are doing the risk benefit analysis, it becomes a little bit more nuanced, right?
Yeah.
The people that are making these decisions, it was colonoscopy first, non invasive test if not, right?
Mhm.
The paradigm for that has completely shifted. If we're saying colonoscopy first, there are serious harms
Oh,
to
yeah.
lowering the screening age, you know, to 30, right?
Yeah.
The incidence of adverse events is very high. Those procedures are incredibly expensive. You can perf the colon, you can cause bleeding from removing polyps. The incidence in that patient population was relatively low, and they didn't really have good non invasive screening options to triage to colonoscopy. So, if you think about it, we don't have enough colonoscopy appointments. We don't have enough GIs to service an entire population 30 and up. We do have enough non invasive tests to service that patient population. There are truly no adverse events associated with collecting a stool sample. The biggest risk is accidentally sending patients to a colonoscopy to
Mhm.
get a test, and then ultimately it's no findings on the colonoscopy. So I think as the paradigm shifts in colorectal cancer screening to say non invasive test first, especially for patients that where incidence is lower or where they have a lower risk, and then colonoscopy as needed. I think that paradigm shift will cause the risk benefit calculations to change. And I think that is happening right now. So I think my anticipation would be that screening age is going to creep lower and lower, and especially if you have some risk factors like a family history or um, you know anything else that might contribute to an increase in disease that's not a red flag symptom. I think we're going to start providing these non-invasive tests in the same way we do for patients 50 and up or 45 and up.
That is incredibly exciting. It makes my day to hear this, honestly. After being in the advocacy space for so many years and reporting on it, it's just wonderful to hear that. And I think so many other people who are listening are going to be very excited to hear that because there is no doubt that the majority of people really want that screening age to change and to not only hopefully get that in itself, but to get it with a non-invasive test, which is like a billion times easier to do
Yeah.
on so many levels in so many ways that you've talked about is a real win-win. So very, very excited to hear your thoughts on that. And as a person who's been working in cutting edge research in the gastrointestinal health and diagnostics space, what are you most hopeful about? In addition to what we were talking about, what are you most hopeful about when it comes to early onset colorectal cancer in our generation?
I think again, colorectal cancer is the most preventable but least prevented cancer of our generation. And I think we have the opportunity to kind of prove cancer wrong, right? I think we know that when patients are adherent to screening, that outcomes are good. We know that we can eliminate colon cancer screening or colon cancer if patients are screened. And I think we're starting to get the ammunition to
Mhm.
actually do that. We're starting to have a number of non-invasive tests that are available to patients, whether it's a blood test or a stool test, whether it's a fit test or a molecular test. We're starting to have multi-billion-dollar companies that are directing every single one of their resources to advocacy, to education, to provider education, to convincing payers that this is important. And so I think, you know, after having built that army, that infantry, that battalion to attack this disease and specifically address the rising incidence in younger patient populations, I think we're really just at the forefront of that battle. And I feel very hopeful and very confident that 5 years from now, 10 years from now, we're not going to be having a conversation of how can we educate people to be screened. We're going to be having a conversation of how can we screen even earlier, or how can we do multiple cancer screenings in a single bowel movement or whatever it is. So I think I'm hopeful that the transition will happen where we're not talking about compliance and we're talking about improvement of the existing technology that we have to address whatever else might pop up.
Well, that's very exciting to hear and something to very much look forward to. Very, very positive to think about. And as we wrap up today's episode, is there anything on the horizon with hold on, I'm gonna say it.
Genoscopy.
I keep wanting I'm so sorry. I keep wanting to say Genoscopy, okay, Genoscopy.
That's fine.
Right. Okay, hold on. I'll say the question again. As we wrap as we wrap up, thank you so much for your patience. As we wrap up today's episode, is there anything on the horizon with Genoscopy as work that you would like to plug? And how can our audience connect with you?
Yeah, absolutely. So I think I have been building ColoSense for the last 10 years, since I met that woman with colorectal cancer as part of my clinical rotations. But I'm an inflammatory girl at heart. My roots are in inflammation. And I think I'm really excited to get back to our pipeline products, which are in the inflammatory bowel disease and irritable bowel syndrome spectrum. So we're also building non invasive tests in the same way that we built for colorectal cancer screening for patients with gastrointestinal distress to again give them a lot more insight into the inflammation in their GI system and how we can potentially address it. So that's what I've been working on
Awesome.
recently. And I think the combination of inflammation and oncology will really hopefully serve our patients and provide a comprehensive assessment of their GI health.
Oh, that's awesome. That's very exciting. I know there are a lot of millennials who have inflammatory bowel disease and so I think are always looking for solutions with that. So it's wonderful that you are developing diagnostics for that as well. Well,
Cool.
very exciting. Well, thank you so much for joining us. This is like so exciting to hear about the cutting edge technology. You have the test and really just I think so much of the time we hear so many stories about the rising cases and like you said we're so for most people so proactive about our health and we want the tools and it's finding those tools. And so talking with you it gives me a lot of hope. I know it will give others a lot of hope as well.
Well, thank you so much, Melissa. It was a pleasure being here today.
Thank you.